Graves disease. Graves disease is an autoimmune disorder which affects the thyroid gland. It is a syndrome characterized by hyperthyroidism, goiter, exophthalmos, and dermopathy. Before discussing the pathophysiology of Graves disease, we must take a look at the normal physiology of thyroid gland. Thyroid gland is located in the neck region and releases the thyroid hormones. The activity of thyroid gland is under the influence of hypothalamo-pituitary axis present in the brain. Hypothalamus releases a hormone called thyrotropin, releasing hormone or TRH. TRH stimulates the anterior pituitary gland to release thyroid stimulating hormone or TSH. TSH moves in blood and binds to TSH receptors present on the surface of thyroid gland. Thyroid gland, when stimulated, starts releasing thyroid hormones T3 and T4 in blood. Thyroid hormones circulate in blood bound with proteins called thyroid binding globulin and reach the target tissues. Being lipid soluble, they cross the cell membrane and bind with the receptors present within the nucleus. T3 and T4 stimulate gene transcription which lead to protein synthesis. Thyroid hormones produce their effect all over the body. T3 and T4 increase metabolic activity and basal metabolic rate. They also increase growth and development by increasing protein synthesis and augmenting the role of growth hormone. They increase cardiac output, heart rate, respiratory rate, protein synthesis, and fat mobilization. Thyroid hormones also promote sexual functions. Pathophysiology of Graves disease. In Graves disease, body produces abnormal antibodies called thyroid-stimulating immunoglobulins, or TSIs, which bind the TSH receptor and mimic the action of TSH. This causes an abnormal increased production of T3 and T4. T3 and T4 in turn inhibit the secretion of TRH and TSH through negative feedback, but the antibodies keep on stimulating thyroid gland to produce T3 and T4. Risk factors of Graves disease. The risk factors of Graves disease include age, gender, and genetics. It can happen at any age but peaks at 30 to 40 years of age. It is more common in females. The female to male ratio is 7 to 1. It has genetic predisposition and may run in families. Some other minor risk factors include smoking, pregnancy, and stress. Symptoms of Graves disease. T3 and T4 have receptors on most of the cells of the body, so symptoms of Graves disease appear throughout the body. Effects of Graves disease on central nervous system include insomnia, anxiety, psychic disorders and seizures. Effects of Graves disease on cardiovascular system include tachycardia and increased cardiac output, hypertension, palpitation and fibrillation, and arrhythmias. The effects of Graves disease on gastrointestinal tract include increased appetite, increased gastrointestinal motility, and diarrhea. Effects on reproductive system include decreased libido, oligomenorrhea, amenorrhea, infertility in females, and impotence in males. The general effects of Graves disease on the body are excessive sweating and heat intolerance, weight loss, and clubbing of fingers. Graves disease may also cause goiter, which is a swelling of the thyroid gland. Thyroid gland is made up of follicular cells. Thyroid-stimulating immunoglobulins continuously stimulate the thyroid gland. This overactivity increases the size of the follicular cells. This increase in the size of the follicular cells translates into increase in the overall size of the thyroid gland. This condition is termed as goiter. Exophthalmos is a common symptom of the Graves' disease. It is a bulging of the eyeballs and occurs in one-third of the patients suffering with Graves' disease. It is caused due to the swelling of the retroorbital tissues of the eye and the degeneration of the extraocular muscles when the TSIs react with them. The diagnosis of Graves' disease involves the determination of thyroid hormone levels in the blood. In case of Graves' disease, plasma levels of TRH and TSH are decreased. Meanwhile, the levels of T3, T4, and TSIs are raised. The radioactive iodine uptake test is also used for the diagnosis of Graves' disease. Thyroid collects iodine from the blood to make thyroid hormone. In this test, small amount of radioactive iodine is ingested. The amount of iodine absorbed by the thyroid gland is measured through a radiation detection device. High levels of iodine uptake by thyroid gland can be a sign of Graves' disease as shown in the picture. Another test which can help in the diagnosis of Graves' disease and differentiating between the Graves' disease and other forms of hyperthyroidism is thyroid scan using technetium. It is done by injecting technetium into thyroid gland before the test. An image of thyroid gland is produced. If the uptake pattern is diffused, it is indicative of Graves' disease as shown in the picture on the right. Graves' disease is a lifelong condition which is treated by carefully maintaining the levels of thyroid hormones in the body. It can be treated using pharmaceutical, surgical, or radioactive therapy. The pharmaceutical treatment of Graves' disease include the administration of beta blockers and antithyroid medication. Beta blockers are the first line of defense in the treatment of Graves' disease. These medications decrease the heart rate until other treatment take effect. For example, propranolol and metoprolol. Antithyroid medications block the production of thyroid hormones. For example, methimazole and propylthiouracil. Radiation therapy is also used for the treatment of Graves' disease. In radiation therapy, radioactive iodine is ingested in the forms of liquid or pills. This radioactive iodine is taken up by the thyroid gland. Radiation released by this iodine slowly destroys the thyroid gland and brings the level of T3 and T4 in the blood to normal. Radiation therapy is contraindicated in pregnant and breastfeeding women. Surgical treatment for Graves' disease is a thyroidectomy, which can be the partial or total removal of the thyroid gland as shown in the photograph. After thyroidectomy, thyroid hormones levels in the blood are maintained by administering synthetic thyroxine.